Hi, we're Nia and Mary-Anne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon.
Hi, Nia. Good
Hello, hello.
morning. Good
How you doing?
morning. Um, we're going to do a sort of rumination today, only
Ooh.
because I was reminded watching a panorama program this week about baby food sachets, about the
Mm,
incredible part that marketing plays in our lives,
mm,
and how it affects our health and decision making in a way that we aren't aware of unless we clock in.
yeah.
Um, and I was watching these really intelligent people get duped basically by the marketing behind baby food sachets.
Oh.
And it made me remember the whole 70s and where marketing really took off around food.
Where we started all getting unhealthy, funnily enough.
Exactly,
Where that
exactly.
graph
And
starts going
I
up.
mean, when were you born? Were you born in the 70s?
I was
No.
not. I was
No.
born in the middle. No, well,
Right,
okay, the
okay,
middle
so
the
there you
middle
go.
80s.
So I remember a lot further back than you, but marketing started to really affect us because before that, remember, it had only been advertising in, I don't know, women's magazines or, you
Mm,
know, the beginning of serious sort of media marketing. And
yeah.
I was there and I was very much duped by the same sort of thing as
Oh yeah.
these people on the Panorama program were
Yeah.
definitely believing or wanting to believe, and that's the
Yes,
point. They
wanting to
wanted
believe.
to believe that they could pay for the convenience of very nutritious food for their babies,
Mm,
that didn't require them to do anything except pick it up in a shop.
yeah.
Okay.
Yeah, you're right. So in the 70s, we all got convinced, didn't we, fat was the thing to avoid. And that
Yes,
narrative
exactly.
has gone on and on and on, and we're still fighting against that.
Yep.
That was incredibly successful marketing.
Very
Um,
successful.
then
Yeah.
the food manufacturers obviously got involved. And I
Yeah.
remember when we had that chat about when you were in America and you saw those sugar
Yes.
sweets and they said they had no fat. And it was like, well, of course they don't.
0% fat on a bag of confectionery.
Of course, there's no fat in sugar, but it's all sugar. Anyway, so what happened
Yeah.
then, obviously, as a result of all that marketing was it made us all fatter, which is ironic, isn't it? And then
Yeah.
probably sicker overall, more heart attacks, which obviously they were trying to
Yeah.
avoid, more
Yeah.
diabetes, all the same stuff. And of course, that, you know, you and I are pretty intelligent people, but we were fooled by
I was
many marketing things.
definitely I thought I thought health was in the hands of some terribly clever scientist somewhere, and
Mm,
that they would never sell us, um
something that would harm
yeah.
us.
I think that's how I grew
Interesting.
up. I think that's how
Mm,
I grew up. And eating those sugar-laden, low-fat, of course, flavored
mm.
yogurts, I remember them as being sold as an incredible health product. So yeah, as long
Mm.
as it had yogurt in it, to be honest, you were going to live forever, right?
Yeah.
And no one ever questioned the sugar content. And in fact, I don't think then that the manufacturers had to display nutritional information anyway.
No,
And
maybe
when they
not.
did, we wouldn't have made any sense of it. And
Mm,
also, sugar was thought to be harmless, I think, in
mm,
the 70s. In fact, my parents, I think, viewed sugar as good energy. I think
mm,
that's what was sold. The fat was the thing you really wanted to avoid.
mm.
Um, I'm not sure how they squared the rampant tooth decay that was about at the time and the tons of mercury that was being put into kids' teeth, let me tell
Mm,
you. But, that seemed to pass things by. But also around baby formulas and baby foods. So I remember I had my babies, I don't know, 80s, early 90s.
yeah.
Um, and I used to use some highly processed products, I have to say, because, I
Yeah.
had a lot of babies
Mm.
and it got towards the end
Towards
of
the
the
end, it got a bit busy.
yeah, it got a bit busy. And the fourth baby definitely had a lot more. ridiculous products. There was, like, powdered baby food, very convenient. You just
Was
tipped it
that the
out of
scrambled egg one?
yeah, you really don't wanna know, but anyway,
Oh, well, I was fed it as well because Mum tells me that
I
she
have
had that.
apologized to my children no end, but I think I still thought that it was all tightly controlled by science. So, I thought
Yeah.
baby formulas particularly would never be sold if they were unsafe.
She says that's really interesting, isn't it? And I think, in health coaching, there's that thing, or in all coaching actually, which is unconditional positive regard towards your coachee. So
Yes,
you only
yes,
think of the person you're coaching in a positive light.
yes,
I think we all have unconditional positive regard for food manufacturers in that we
yes.
think they couldn't
I know.
possibly be trying to harm us or give us anything that wasn't
Yes,
safe. And if
yeah.
they put healthy on the packet, we all believe it.
Exactly. And why would we not, you see? Because that was would and as a nation, wouldn't it be in our interests to feed us healthy food? I think I had this feeling that establishment, governments, I don't know, science bodies, whatever, would never sell you things that were
I
bad for
don't.
you. The bad for you was the other things, you know? I
Yeah.
mean, I
Interesting.
just think we were so taken in, and I even vaguely remember, which you definitely won't,
Hmm.
the marketing around cigarettes and that air of style, sophistication, and even sort of sexiness about
Oh,
smoking.
there was one with a ribbon, wasn't there? I can't remember, like
Yes.
a purple ribbon.
I
Um,
mean,
I
it
didn't see
looked
so I didn't
very
see the
attractive.
television adverts because
Yeah,
remember I didn't have a TV.
yeah.
But I did see them on the back of magazines.
Yes,
Mm.
and you would have thought it was glamorous
Oh,
because
yeah.
that's exactly what they were selling you. So when I was 19, having avoided cigarettes until then, hospitals were absolutely awash with cigarettes, by the way. So the
Mm,
coffee room, there was like a million people smoking in their coffee
mm.
break in a big hospital. It's
Yeah.
hard to believe, isn't it? But
Well, yeah.
that was partly, marketing because I and also they caught the feeling of relaxation with cigarettes, so if you've never
Yes.
been a smoker, you won't know, but it's that almost recreational drug side of cigarettes that
Can you
people don't know unless
imagine?
they smoke, yeah.
Can you imagine advertising cocaine? I mean, cocaine's not relaxing,
Exactly,
but,
exactly. Well, it's not anything different, is it?
Oh, it's mad. And then of course we obviously still advertise alcohol and gambling as
Yeah,
something that
yeah,
could be fun
fun,
and yeah.
yeah,
Even though people I've still got to listen to it, but there's a podcast I want to listen to about a lady who got herself into a huge amount of debt and lost her entire
yeah,
life to gambling
yeah,
basically.
I heard
And
it
then
the other day, yeah,
yeah, both of us have obviously been and seen patients with
yep,
huge problems from alcohol,
yep,
and
yep, yep, yep.
ascites and all the rest of it,
Yeah,
nasty stuff.
people
And
dying of alcohol abuse, yeah.
yeah,
And
and
just the
obviously, you
mental
know,
health side of it, yeah.
yeah, and then the people who suffer and who are in hospital, it's costing the NHS ridiculous amounts, like £3.5 billion a year or something mad.
It
So,
is, and you
mm,
know what? If you and we'll cover this a bit later, of course, if you question advertisers or marketeers, they will say, "Ah, but it's a choice, but
it's
we'll go
always a
there
choice.
later." Yeah.
Mm.
But it
And
got
this is
me thinking, yeah, all
Yeah, this
about
is the bit that
yeah,
really grinds my gears, for want of a better thing,
yes,
because
yeah,
I respect everybody's autonomy
yeah,
and the ability to make your own decision. You are an adult, you
yes,
can do whatever you want. But I feel that you should be given a balanced argument and all
yes.
the information to make an informed decision. And marketing, particularly in some of these food, cigarettes, alcohol, gambling, you
No,
don't see the other side of the coin.
no.
And that's not fair, because how can you be
Yeah,
able to make an informed choice if all you're being sold is
yeah.
this is really good?
Exactly, and that's what the pouches made me think about. And I
Yeah.
started thinking about health campaigns and that tension in our culture about us being adults and having the right to make those personal choices. That's really what got
Yeah.
me thinking around our behavior and how this works if you want to get out sort of good messages out there. So
Mm.
how do we make marketing work for us?
For the good people. Yes, because
Yeah,
actually, when you think about all of the marketing messages, say for example, smoking, right? We used to have
yeah,
these glamorous things with the ribbons
yeah,
and
yeah, yeah, yeah,
and all we see now is those, well, we don't see them because, but
yeah,
on the cigarette packets, the awful
yeah,
fear,
yes,
scary things of you'll get mouth cancer, this is what your lungs
yes.
will look like, all of
Yeah,
that. So they've got
Do you know what,
scare appeal.
that's called in the trade?
No, what's that called in the trade?
So I had a little look at health campaigns and how they work just for interest, because
Mm.
in a way, we're health campaigners, aren't we?
I think we
Um,
are.
but it's known in the trade as fear appeal.
Yeah, so the basically it'll scare the pants off you.
Yeah,
So if you look at this
yeah,
picture of someone with mouth cancer, you won't
exactly,
want to have the cigarettes.
exactly.
Yeah.
Okay. So instead of now selling them as this, sexy, adult, slightly illicit, slightly naughty thing,
Mm.
you're now putting pictures on of lung cancer.
Yeah, tricky, isn't it? Because
Yeah.
in a way, what you want to be able to do is advertise the person who's got great health, who's never smoked, who's enjoying,
Yeah,
but
we don't
yes,
see that.
we don't see that.
No.
Interesting. And
Okay.
there is that disconnect between there's a lot of talk about the nanny state and the government can't tell
Yes,
me what to do and you can't tell me
yes.
how to live my life. And it's
Yeah,
not just in Britain, it's all over the world
exactly. And there is a tension in that. I sort of get that. There is, because the nanny state would have to be right. I mean,
all
you
the
have to
time.
challenge things anyway, don't you? I mean, it's like saying, I don't know, fascism's okay because the nanny state says it's fine. I'm
Well,
not,
there you go.
I
See,
mean,
so the trouble is that we don't
yeah,
always get it right at the top, and then that
exactly.
means that people don't believe what comes from the top,
Yeah.
and so of
Yeah.
course, yeah, then you've got this, fair enough, a lashing out or lashing back or
Yes,
whatever you want to
or
call it,
questioning. Yeah.
questioning, and I respect questioning.
Yeah,
We're
it's
we're
part of
big questioners,
democracy, isn't it?
yeah, but sometimes I often think, well, this is just so blatantly obvious. You'd just be a fool not to believe it.
So the low fat story is right, quite a good, let's veer off fascism, probably not our business,
Probably
but
probably for the best.
probably best. But low fat is our business, and the fact is we
Yeah.
were sold low fat as a fact, and then there's been a turnaround, but not in all quarters, and we're still
No.
struggling really to get a balanced sort of view and argument.
Mm.
Um, and the other thing that manufacturers use, and I think this is really interesting, is they put the ball back in your court by saying, "But you're
It's
an
your
adult."
choice.
So a famous fizzy drinks company was asked about their sugar content, and I remember them acknowledging that their product was high in sugar,
Sugar. Yeah.
but saying, "Well, consumers choose to use this,
Yeah.
and they know that it's high in sugar, but, they also can choose our lower sugar products with sweeteners, which all came after the concerns, by the way, around the
Of
sugar
course.
thing,
Yeah.
because they then started producing, they also bought fruit, juice companies,
And water companies.
and not silly about this, but what they're saying is it's not our responsibility how adults choose. So
Mhm.
therefore, as long as we're giving you the correct information, it's entirely up to you. They also don't mention that quite a lot of fizzy drinks contain caffeine, and that's been slightly, I don't know, left out of the equation. But yeah, caffeine is highly addictive, as is sugar. Well, the argument rages about whether sugar can be termed as addictive, but I'm pretty sure it is.
Mm.
So you've got that combination, that fabulous combination of carbonation, sugar, and caffeine. I mean, and then it's sold as some sort of a little bit like cigarettes, something really adult and lovely to choose.
Mhm.
How does this work then? So how do we, who want to peddle health, how do we make use of marketing?
Yeah, I think that's really important because I think if the one thing you would want in your life, right, is good health,
Yes.
because actually
Yeah.
the more people I meet with bad health and the
Yeah.
more,
Oh
I
god.
mean, it's been a lifelong thing for me, obviously, but
Yeah.
the when you kind of reflect back on your own health
Yeah.
changes and how you feel now and how you used to feel and all the rest of it, I think, golly, people don't really think about their health until they're in trouble. It's often
And we
too
sort of
late.
know that.
And
Yeah,
we all
exactly.
know that,
Yeah,
we could, they just don't realize how much power they've got to influence their health outcomes. But I
exactly.
do think it's because
Yeah.
they also do not at the fundamental level do not believe that these companies could sell them something that harms them.
Yes, that's interesting.
And at an underlying level, they think if something is on the market, it must be safe. And I think we
Mm,
probably have terribly
seeing
such
the light.
cynical brains now
Seeing
that we're
the
like,
light,
no.
yes. So how do
Mm,
we sell the light? This is exactly what I was all this musing was really the idea that how do we make health really
exciting.
attractive?
And that's as
And
well that and then remember, we've also got Western medicine, which just
yes,
brings out another antidepressant every time we're all sad.
yes,
And
yes.
you know,
Well, it
it's
tells us, it's done a great job of convincing us that Western medicine holds the answers to all your ills.
well, exactly. I mean, that's not a new thing either. That was
Oh, no,
around in
long
the
way back.
Victorian times
Yeah,
when healthcare became
mainstream.
mainstream. Yeah, so when apothecaries were
Yeah,
formulating things and whatever, there's a well-known cartoon called A Pill for Every Ill.
yeah. Which you
It's
would know
just
in pharmacy, of course.
of course, yeah. Sorry, just a bit of random trivia from my brain there. But that's the thing, we've been told,
Yes,
"You've got a problem, we can fix it,"
yes,
without suggesting
yeah,
that any of these problems could have been prevented had we lived a bit better or a bit differently.
exactly. And it still goes on in that we are treating people on a disease model without adding that lifestyle change bit in. So we're still
Mm.
doing it. We're still
Mhm.
saying you can control your blood sugars. So something's gone wrong here, but we can fix it by controlling your blood sugars with medication
Yeah,
without adding that, in fact, there's lots of lifestyle measures that will do the same, if
yeah.
not better. So we
Do you know the
forget
other
that
thing that
bit.
I think is mixed up in good health messaging, right?
Yeah.
So, when you're advertising sugary fizzy drinks, nearly said a brand name then,
Yeah,
but when you're advertising that, you only have to tell people about the good stuff, right? That's
exactly.
within
You're
your
not
gift.
going to
You're trying to
say
sell them
anything
something.
about the other. Yeah.
No. But when you think about public health campaigns and
Yeah.
what we're trying to sell them, we're trying to encourage you to do what we think is best for you. I don't know, whatever
Yep.
it might be.
Yep.
Um, but there's also an element of shame in it. So if you can't do the thing that we're telling you is better for you for any reason,
Yeah.
then it's a personal
Okay, so
problem.
you
It's a
failed,
personal
then
failing.
okay, that's
Yeah.
interesting. And that comes up particularly in things like diabetes and obesity,
Mm.
where
Mm.
they basically a marker of your failure to look after your health. I
Mm.
I
If you
loathe
think
that
yeah,
idea, but that's very much there. Yeah.
yeah, and if and
Okay.
also, I mean, loads of things. So, let's think one of personally, one of the things I've felt a huge amount of shame around was my inability to be able to breastfeed my children
Oh, yeah.
because I
Yeah,
had
that's a good one.
I
Yeah.
started off okay, and then I developed a massive abscess and I
Yeah.
had to have it
Yeah.
drained, and I won't go into the gory
Yeah,
details, but it
yeah,
wasn't
no.
pleasant.
Yeah, but
Anyway,
you felt you were failing.
I felt I had failed, and
That's
it
awful.
was
Yeah.
it took me a long time to get over that
Yeah, I bet.
because, of course, as a healthcare professional, all I wanted to do was the best for my child, but I felt because everybody was geared up at trying to help me to feed, and actually it got to the point where then they said, "Actually, you can't." Um,
But
but
the feeding was considered the best option for you.
exactly.
Yeah.
And then when I had to resort to formula and nobody came alongside me and said, "You know what, Nia, you've done your best. Don't
Yes,
worry
you're
about it.
actually
There's
all
nothing you
right.
could have
Yeah,
done.
yeah, yeah, yeah.
Now
Mhm.
apart from my husband actually, who was wonderful, but all the healthcare professionals just kept saying, "Well, you can just do it this way and you can do it that way." And I'm like, "But it's not. It doesn't work like that. It's not
Don't
helping."
I mean, and don't we still do all of that if you think about a lot of the things we deal with?
Yeah.
Um, but what I started then to think about was what health campaigns do we know about that have
Mm.
been really, impactful?
Okay.
And obviously, we've talked about the first one, which is
Smoking.
smoking. So
Yeah.
I think we made no difference, interestingly, or not very much difference until that 2007 ruling about public places and smoking.
Okay. Yeah.
I was
So
very cynical about that. Do you remember that? I
I
remember
do.
thinking, this is never going to work. People just go outside and smoke or whatever.
Well, I
But
remember being in
actually,
restaurants where you had a
yeah,
smoking section and it just all
yes.
descended on the non-smoking section
Look,
anyway.
I
That was
remember
hilarious.
aeroplanes where people smoked in a smoking imagine. Um,
Yeah.
but it changed everything that, it really was incredibly successful to ever thought about it. And it made a huge difference. So that's interesting. So that wasn't fear-based. That was more like, I don't know, seat belts. So you get
Yeah.
fined if you don't use a seatbelt, and there's no discussion about whether you want to or not, whether it's adult, whether it's an informed choice. It's like, we'll fine you if you don't.
Yeah.
I
Mhm.
don't know the exact data, but I presume that there were less injuries.
I'm sure there were. I'm sure there were
Yeah,
less
I'm sure.
deaths.
The other one that's
Yeah.
come up recently is SIDS. So
Oh, yeah, so sleeping on the back and feet to
yeah,
foot
babies
to
sleeping on their
what
backs.
was it? Foot to feet. What's the thing about where you put the baby at the bottom? There's a
Yes, can't
foot to
remember, but
bottom. Anyway,
what I
there's
do
a
know is that everyone having babies now is very aware of that
yes.
campaign,
Yeah.
and
Yeah.
they definitely do not, put their babies to sleep on their stomach. So that's really interesting, and that the data on that is very good. Although
Mm,
I was pretty disbelieving myself, but the data's just
very
you
good.
can't
Yeah.
really argue. Another really good campaign was basically immunizations.
Yes, and that's a massive political hot potato, but I think the other thing
Yeah,
to be aware of is,
yeah,
immunizations are not perfect, and
no,
no medicine is perfect.
no,
However, we had eradicated some pretty horrible diseases. It's worth
and
knowing
that's
about
the
those.
problem, Nia, because once we'd eradicated them, we lose some of the fear factor. And the fear
Mm,
factor is, remember, what starts most of these things off on a successful sort of. So screening programs for breast and cervical cancer, again, there's a fear factor here. It is about prevention, as is immunization,
mm,
but the fear of not doing something and then the consequence is sort of what they're based on.
mm,
So the
mm.
problem with immunizations at the moment is there's these question marks have been left, and then you haven't got the fear factor because there's not many children getting measles, for instance.
Yeah, but then you don't have to look that far back. My
No,
nana, so
no. Yeah,
my
but you
own
don't look back,
grandparent had
You don't
measles and
look
went
back.
deaf as a child because of no
Yeah, that.
immunizations.
Yeah,
So
so that yeah. But a
we
lot of them don't know that.
a lot of them don't know that. It just depends on what. But anyway, so yes, a
What
lot
about
of
the
these.
COVID immunizations? And that's a really interesting little
Mm,
illustration. They even got us to stay at home.
mm. So I think
Enormous fear
ultimately
factor.
a lot of these campaigns are based on you've got to do the right thing or the terrible thing will happen to you.
Exactly,
Um,
exactly. So
which is not what the people who are trying to sell you stuff that'll damage your health, they don't have to meet up these expectations.
no, but then how do
Interesting.
we as health coaches, that's the point, how do we sell our product without the fear factor? So
Well, quite.
so so that's the question for us, and I think we'll do that in another podcast,
So
but
what has been successful that's not been based on fear?
so I
That's the
looked
question.
at that, and do you recognize any of these? Better
Okay.
health,
Yes,
maybe?
maybe.
Change for life?
Yes, definitely.
Definitely. 5 a day?
Yeah.
Although that's arbitrary.
Yeah.
Catch it, bin it, kill it.
Yes.
Yes. Movember,
Yep.
Stoptober.
Yes, smoking cessation.
Uh-huh. I didn't actually know. No, I think it isn't it alcohol.
No, I think Stoptober's smoking because
Oh,
a
you're
dry
right. It's
January is
smoking.
January.
Yes, it's smoking.
Yeah.
Okay, dry January.
Yeah,
Every
definitely.
mind matters, which is a.
I do know that one. I recommend that one quite a lot.
Oh,
Do you know
okay.
that
There you
if you
go.
go onto the Every Mind Matters webpage, a little bit of
Yeah.
free NHS trivia for you, you can curate your own mind plan. So they'll make you do a little
Okay.
quiz and then they'll give you some signposting to some things that might
Maybe I
help you.
should do that. Right.
Mm.
Oh, so these are all campaigns that are selling you health, not
Yeah, you list
fear.
a few. I've got some I listed on my little post-it.
Okay.
Better Health, Better Families. So that's a new
Okay.
public
Yeah.
health thing.
Yeah.
One called Good Thinking.
Okay. Never heard of it.
Yeah. So yeah, there's quite a few, and I think the trouble is they don't get as much airtime, and they're
They
not as
don't. They
enticing
don't.
or as exciting as
Well, you ignore
rot
them
your
if
teeth
you're
with our
healthy,
drink.
in inverted commas, don't you?
Mm, Mm.
So what does this teach us about how to sell health? And I thought about the 10,000 steps, we've talked about it before, but
Mm.
it was incredibly successful in Japan because, well, it actually wasn't only Japan it landed up being successful in. They used the Olympic Games basically to promote activity levels. And it
Mm.
wasn't very, as we know, evidence based. But what it did get was people thinking about getting more active, and the legacy goes on. So people are using pedometers and messing about with how many, and there's all sorts of terrible equations online about how many steps you have to take to lose weight. Anyway, we
Oh,
won't talk about that because we've talked about it before, but
yeah.
that's sort of interesting that that caught on. And
Mm.
interestingly, I met someone last night who'd given up alcohol for a couple of months now because he's training for a big ride on his bike
Okay.
and he's very keen to do the best he can. So, but what he said was, I feel so much better without alcohol, I might never go back.
Mhm.
So if we could change that, so he said he drank quite a lot in the past at various times, usually job related or whatever,
Mhm.
stress related. He just realizes now that if he doesn't drink, he feels so much better in the mornings.
It's fascinating, isn't it?
Fascinating.
I
So
this
isn't
is
that the key to the
Yeah.
sale of our health? Can we get people to feel better and then want to feel better?
I say this so often. Like,
Yeah.
once you've given it a try, once you've
Yeah.
done it, and once you've linked how you feel to the changes that you've made, boof,
You'll
off you go.
never go back, will you?
But
So
how do you
we
put that in a marketing campaign?
how do you do that? And of course, the one area that there is a buzz around is weight management
Mm.
because in our culture, it's obviously a huge problem, but it's also culturally, not considered not acceptable to be overweight. So there's all that, there's a whole
Yeah.
lot of stuff around weight.
Yeah.
But it's the one thing that sells health, doesn't it?
Mhm.
And
Mhm.
we know that because we didn't really want to sell health from a weight point of view. I
No.
mean, weight's part of health, but it's not the
Yeah.
whole thing. So
Interesting.
so why don't we next time, because we've rambled on enough now, is talk about how we would sell health. How can we sell health in Suren?
We need health marketers.
We do.
Mm. That's an
And
interesting
how
concept,
do
isn't it?
we have a campaign all of our own to sell Suren health
Yeah.
coaching? You
And
see,
and
if we,
how do you get those people
yeah,
that say you can't tell me what to do?
yes.
How do we engage them and say, I'm not telling you what to do, I'm just
No,
giving you
I'm
some
just
information.
offering you a little view of what you could do. So I'm thinking about the guy who gives up alcohol.
Mm.
So he would not have been told to give up alcohol. He had his own
Oh no,
reason
he had his
to do
own,
it.
yeah. Mm.
But once he's done it, he thinks, "Oh, this has so many more benefits than I ever believed."
Mm.
So
Yeah.
how do we use that sort of example of saying, "Come with us for a week
And see
and
how you
we'll
feel.
start you off and you're going to learn so much, and the choices you make after that are going to be so much more informed. Not that
Mm.
we'll tell you how to do it or that everyone does it the same way or that everyone is turned on the same way
Mm.
to health, but how can we sell you just that first little view?
Mm. Interesting, isn't
Anyway,
it? Because I
we'll
think
talk
I think
more.
there are those the other thing about health marketing, which we haven't touched upon, but I think is just worth having one final point on, is that the people who don't want health or who are inherently more unhealthy are not engaged by the adverts with the people who are influencers online trying to sell you the
Yes.
supplements, trying to sell you
Yes.
the protein bars, the shakes, you
Yeah.
know, and ultimately you don't need the protein bars, you don't need the supplements, you
No.
don't need all of those things
Yeah.
because they are trying to sell you something to somehow optimize your health. But if you haven't done all the work in the background, the foundational things,
Yeah, you're
those
right.
things are not going to make any difference.
No,
We're
you're
not
right. You
elite.
won't necessarily be influenced anyway because you won't be turned on to them.
No, 99% of us are not elite athletes, so we don't need specialist sports
No,
nutrition.
no,
Um,
but the protein aisles are
would would
burgeoning.
would would
with
tell you otherwise, wouldn't they? The fact
Yeah,
that there is a sports nutrition aisle in Sainsbury's tells you that we think that in order to be healthy, if we do any exercise at all, we need a protein bar afterwards.
Not only
Um,
do we need that, Nia, we apparently need a hydration sachet as
oh,
well.
electrolytes, of course we do.
Yes,
Yeah.
we do apparently. I
So,
saw something this morning saying, "Do you hydrate yourself optimally with these
mm,
little sachets? You just pop them in your water bottle." Well, I think that's pretty convincing if you didn't know any
yeah.
better, because you'd think.
Interestingly, also,
Yeah.
this really got my goat, and I want to know your opinion on it. So I saw something on Instagram
Yeah,
about a chap who was saying he was a sports nutritionist
yeah,
and he had lots of knowledge, and
yeah,
he said need children who are performing at doing a lot of activity shouldn't be fed solely on a diet of whole foods, whole grains, good
right.
adequate protein, healthy fats. They need sugar apparently.
Yes, well, weren't I mean, this is full circle, isn't it, to what
He
we
had a
talked about?
convincing argument, but I did think, I'm sorry, what?
Yeah.
Like,
Well,
what?
children get energy from all their food, as we know. So, no,
Yeah.
they don't need extra.
They don't need like, he was
No,
basically talking about the very sugary sports drinks and
drinks.
bars and things. I was thinking,
Well,
no, I mean, if you think a child has expended that much energy that they need to replenish that quickly,
you're in trouble.
yeah, I mean, your child is going to keel
Who's,
over.
who's his backer, I would ask.
Well, quite. But anyway, so that was
Yeah,
one of those things, and
but
also,
that's
yes,
that's unethical, I think, but
I
and
think
that's the
it's
problem about social media. So, we'll talk about that next time, maybe.
yeah. But anyway, that was just my last little piece of the pie.
Yes, no, agreed. Yes, I haven't got any electrolytes, so I won't be able to do anything
Too
too
strenuous. Oh, you be
strenuous
careful
today.
now. You be careful today. I'm worried about you. You've not taken on board all your
I mean, you
electrolytes.
can't garden without an electrolyte sachet, can you?
Well, no, I think it's illegal.
You're naughty. Okay. See you next week.
See you next time.
Bye for
Bye.
now.